Now we'll give you the option set. And it is A, decreased action of the sodium potassium chloride cotransporter, B, decreased countercurrent flow of the vasa recta, C, decreased acid excretion, D, increased action of the sodium hydrogen proximal antiporter, E, increased production of the new HCO3 from the renal tubules, or F, increased reabsorption of filtered phosphates. Please put your answer in the poll now. Everybody's answer is in. It looks like most folks went for E, increased production of the new HCO3 from the renal tubules. We had a few folks go for C and for F. And the key correct answer is E, increased production of new HCO3 from the renal tubules. So any students want to weigh in on how seeing the option set may have changed things?
Initially, I had thought that we would be talking about reabsorption. Since this is a chronic case, like they gave us that it's a 5-year history. So now the patient can only reabsorb so much phosphates. She's trying to do a compensatory mechanism where it's almost getting close to the 7.4 pH. My mindset was that we would go on, keep it reabsorbing, but because this is a chronic stage, we have to increase our bicarb production. So only then we can kind of compensate for this increased levels of acid that is being present in our serum.
Faison, I want to thank you for explaining that, because I was also thrown off by the production versus reabsorption. And while I still did pick E because, even though the question did give a lot of like story and fluff, if someone wasn't sure about the lab values, they could just think about the pathophysiology of COPD. And it's an obstructive disease. You're not getting rid of the CO2 you're retaining. So how are you going to compensate for that? If your pulmonary system is sick, you have your kidneys. And what do? They do something with bicarb. So that's why I picked E.
Just in seeing the question stem and then reading the answer choices, as I went through these answer choices, I kind of focused on the purpose of each option was, or what the goal action was of each transporter or the vessels. So I think understanding the pH and then understanding the different values, different partial pressures or the different pressures, and then also understanding that the patient does have COPD and what that's actually doing. And then realizing, okay, well, if this is high or this is low, then to compensate, the kidney will try to do X, Y, and Z. So for me, just going through and seeing like sodium potassium chloride, looking at solute, what's important, solute or bicarb or acid, just knowing what I'm looking for kind of helped me go through those questions and kind of mark certain options out as I read them.
I also found myself looking and tempted by answer choice D. If you're not completely aware of the directionality of the antiporter, you might think, oh, you're excreting hydrogen through the urine, increasing acidity in the urine, which I mean is a plausible process. Again, so I found myself, as we've all mentioned, we're thinking, oh, reabsorption of bicarb, and that wasn't an answer choice. So then I doubted that, ultimately kind of committing to the bicarb, but I was tempted by D.
Probably a good time to share with you all that we get a set of guidelines and also kind of best practices for creating these questions and also the choices. And so what I wanted to add to this was that all of the choices do have to be something plausible. They can't be completely out of left field and something that's not actually a physiologic process. So all of these choices probably apply to something, and your job is to arrive at, let's say, the top 2 choices.
I want to thank Dr. Nori for mentioning that NBME does not come up with random processes and that everything in the answer choices are valid and real.